Welcome today to Instrument Processing and Infection Control, Best Practices developed by Hayes Handpiece. The goals of this CE course are to make the instrument reprocessing safer for the dental team, ensure an efficient and productive reprocessing procedure, and prolong the life of the instruments to reduce overall costs for the dentist. There are several proper steps to instrument processing. Those include instrument cleaning, inspection and functionality testing, lubrication, packaging, sterilization, and storage. We will go over each of these in more detail. The 6 steps of instrument care and cleaning are holding and pre-soak, rinsing, cleaning, lubricating all hinged instruments, the sterilization, and storage. Personal protective equipment is standard and requested by the CDC. For healthcare workers and dental healthcare professionals, protection includes head cover, masks, face shield, goggles, gloves, shoe covers, and gowns. Step 1 includes holding and pre-soaking of instrumentation. One never wants to hold instruments in a container, in a dry container where the instruments get dry. This is because body fluids will cause corrosion, and dry contaminants are more difficult to clean, requiring the possibility of damaging and hazardous cleaning techniques for the dental healthcare professional. You want to use an ultrasonic cleaning detergent or enzymatic foam for pre-soak. You want to always separate metals. This includes carbides from stainless steel. You never want to use bleach. Always open hinged instruments to their full open position, and you want to change the bath daily. Step 2, rinsing. Rinse the instruments under warm water, not hot, for a minimum of 30 seconds. This will help remove blood, bodily fluids, and tissue debris. You want to separate, as discussed earlier, dissimilar metals, including stainless steel, chrome-plated, and carbides. Step 3 is cleaning. All visible blood, bodily fluids, and debris should be completely removed prior to sterilization. Cleaning further eliminates bioburden and debris from hardening onto instrumentation during high-temperature autoclaving sterilization processes. There are several cleaning methods available. Manual cleaning, which is not recommended due to the possibility of sharps injury. Ultrasonic cleaning, which is most common, and automatic washers. This is increasing in popularity within North America. Manual cleaning. The instruments are soaked in a solution of cleaner for an extended period of time. It's not recommended as it increases the likelihood of instrument drabs for the dental health care professional, and the wire brush can cause damage to the instruments. Ultrasonic cleaning. An ultrasonic cleaning device is utilized. Instruments are submerged into a cleaning solution in an ultrasonic receptacle, also sometimes called a bath. Waves are created, which create bubbles that adhere to the surface of the metal of the instruments. The bubbles implode and disturb the bonds of the organic debris on the instrument, which goes into the solution and away from the instrument's surface. As discussed, we never want to mix metals in the ultrasonic cleaner. Keep carbide burrs and a burr block in separate ultrasonic bath or beaker. We want to change the ultrasonic bath daily or as needed during the day to maintain effectiveness. And a step or a efficient manner to effectively verify the functionality of the ultrasonic cleaner is to place a piece of tin foil over the bath while the unit is running for 5 minutes. If the unit is functioning properly, the foil should have small holes or small indentations the size of BBs. Automatic washers. These work like the standard dishwashers that we have at home. They automatically wash the instrumentation. They're safe both for the healthcare worker and the dental healthcare practitioner by reducing the risk of exposure to blood and bodily fluids. Step 4. The lubrication of hinged instruments. Lubricate after general cleaning but before sterilization. You want to lubricate all hinged instruments which have metal-to-metal action needed to be lubricated. Do this weekly to keep the hinge from sticking, and only use instrument lubricant. Steam autoclave sterilization. This is preferred method of instrument sterilization. Always dry the instruments prior to the sterilization process. This prevents spotting and rusting, and prevents introducing non-distilled water into the sterilizer, which can cause damage to the device. Instruments can be autoclaved individually in wraps or bags, or autoclaved in sets using cassettes. Hinged instruments should be in the open position to effectively sterilize inside the hinge. This is recommended by the CDC 2003 guidelines. And you always want to follow the autoclave manufacturer's instructions. Step 6. Storage. Instruments must be allowed to dry before handling. Any moisture or contact with non-sterile gloves or other surfaces will contaminate the pack and render it non-sterile, otherwise known as wicking, and this is also listed in the 2003 CDC guidelines. Instruments may be stored in cassettes, autoclavable bags, or any other approved device. They should be stored in a cool, dry, protective area, and instruments which are not used within 30 days should be re-sterilized in a new bag or wrap. General instrument care and inspection. Always remove rusted instruments from circulation and dispose. Corroded instruments will contaminate other instruments in cleaning and sterilization. This will lead to increased replacement costs associated with instrumentation. To determine if the instrument is spotted versus corroded, a simple test is to use a pencil eraser and rub the spot or rust. If the spot goes away, this is generally spotting and can be usually cured by drying the instrument prior to sterilization. If it doesn't, it's typically rust. Sharp instruments will significantly reduce the procedures, reducing hand fatigue and increase production for the office. Most hygiene instruments should be sharpened between patients or daily. Most offices' sharpening systems can only keep a sharp edge sharp. They cannot take a dull instrument and make it sharp. And most surgical and orthodontic instruments that have sharp edges usually require professional sharpening and cannot be done in the office. This concludes our presentation today. I'd like to thank you. And once again, this was an instrument processing and infection control best practices developed by Hayes Handpiece.